Mexico has made enormous strides as a nation within the last 20 years. But with those changes has come a transition in disease burden. Unlike 30 years ago, now the major causes of morbidity and mortality in Mexico are things like heart disease, diabetes, and kidney diseases. Chronic diseases are the biggest challenges facing the Mexican healthcare system, but chronic diseases are expensive and require frequent doctor appointments. The Mexican healthcare system is not prepared to handle this level of demand. The Mexican healthcare system is faced with the problem of a shortage of doctors. As the World Health Organization reported, there were as many as 7.2 million professional health workers needed in 2012, and this demand is estimated to increase to 12.9 million. It is estimated that Mexico has 1.2 specialists per 1,000 people currently, while the World Health Organization recommends at least 2.9 specialists. Healthcare workers and specialist shortages can lead to patients having less time with providers, decreasing quality of services, and increasing cost. An even greater problem Mexico is facing is the unequal distribution of doctors. Physicians prefer to stay in large cities like Mexico City. Also, there's a lack of resources to prepare specialists. For instance, applications for a single medical school can reach as high as 4 times the capacity of the medical school can afford. Telehealth is the delivery of health-related services and information via telecommunication technologies. It allows patient-clinician contact and care, education, intervention, and monitoring from a distance. Telehealth can be discussing a case over mediums like telephone between 2 clinicians, or performing robotic surgeries between facilities by remote access. Telemedicine is the use of telecommunication and information technology to provide long-distance clinical health care. Telemedicine has been successful in overcoming distance barriers and improving access to healthcare resources, especially for rural communities. Teleeducation is defined as the use of information and communication technologies that provide education for providers, patients, and learners from a distance. Teleeducation enables physicians to keep pace with evidence-based medicine by obtaining continued medical education and establishing worldwide peer groups and educational tools. These educational tools include clinical care guidelines and best practice recommendations as well. Telehealth is proven to work in Mexico. In the state of Oaxaca, one project did more than 500 pre-op evaluations by video chat with no increase in complications. And telehealth is trusted by doctors and patients. A survey of community doctors found that 93% of them would trust telehealth appointments, and 100% of patients asked said they would be willing to try it. So what does Mexico need to make this happen? Your critical investment in internet infrastructure and hardware. Data transmission is the holdup point. Imagine this. You are a community healthcare worker with big plans to perform mammograms in rural villages. You have the machine, you've got the patient's images, and you have the radiologist waiting to read them in the city, but then you can't send them the pictures because the local internet is too slow and your computers are too old. In the end, you only reach 1/3 as many people as you planned. This is exactly what happened to a major health project in Mexico recently. They ended up physically driving the data to the city for a reading. What a waste of time. A simple investment in internet for the area could have tripled their effect. Your investment in internet coverage and telehealth hardware could make a huge impact. And the best part about this proposed investment in telehealth, it can be done completely within already existing channels. The National Center of Technological Excellence in Health, aka Cenetic Salud, is a well-established government agency dedicated to the implementation and improvement of telehealth in Mexico. They review and publish regular reports on the state of e-health, so investments can be channeled through a sustainable, trusted system, and the Mexican people can continue to have ownership over their own health care. So there you have it. We know it works, we know people want it, and we know that the government is ready to do it on a large scale. All that is missing is help from you. With an investment in technological innovation today, we can ensure sustainable healthcare for Mexico into the future.